Okay, and so next up we have Judy Wu speaking, and Judy will be presenting on demographic factors associated with eco-anxiety in British Columbia. And these are findings from the Youth Development Index. So without further ado, here is Judy.
Hi, everybody. Thank you for joining in on my presentation today. Let me share my screen. Is that sharing properly? Okay,
Looks great.
perfect. Thanks, Allie. So actually, a small change to the title. So I'm actually going to be presenting on some regional differences in eco-anxiety. I am also working on the demographic differences as well. But those findings are still kind of a work in progress. And some of you, I was presenting this morning to the Climate and Health Community of Practice Town Hall, and I recognize some names. So if you were in that session this morning, you will be seeing similar results in this presentation as well, just as a heads up. So feel free to listen again or go grab a quick break or something for this presentation. So I'm a PhD candidate at Simon Fraser University, and this is part of my thesis work. It's also partially funded by the Ministry of Health seed grant, and I'm hoping to work on some uh, um, knowledge translation items that will go at the end of this project. But I do want to acknowledge that I'm presenting today on the traditional territories of the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam peoples. And that work was conducted on these lands as well. And I'm an uninvited settler, but I'm very grateful to be living, working, and playing on these lands. So, as many of you know, there's a wide range of emotions related to climate change and broader environmental issues. Um, I'm going to be focusing specifically today on eco-emotion or eco-anxiety as an eco-emotion, but there are so many other eco-emotions that are beginning to be researched currently. Um, but so far, the literature has really been focused on eco-anxiety. What's important to know is that eco-anxiety is a justified response, considering the scope of the global environmental crisis. It's okay to be feeling anxiety about climate change and the environment. That's very normal. But what we don't want to do is like shame those feelings, or do we want to pathologize eco-anxiety necessarily? But what's important to note is that eco-anxiety can become disruptive to one's daily life, and then if it is becoming disruptive, that is usually a time when it may be important to provide certain support resources or to intervene. Maladaptive experiences can include excessive rumination, disruptions to daily functioning such as work or sleep, as well as feelings of intense fear or anxiety that could lead to certain behavioral changes. What's particularly concerning is the impact that eco-anxiety may have on younger generations, such as children and adolescents. I want to focus specifically today on adolescents, as this is the age category that we work with in our lab. Adolescents are particularly vulnerable to psychological impacts from climate change and environmental issues. This period is already characterized by many physical, cognitive, and social changes. And so this age group is already disproportionately susceptible to mental health impacts. For instance, many of you may know that the majority of people living with a mental health disorder have symptom onset prior to the age of 25, and usually in adolescence or late adolescence. And this is a time when often one begins to start learning about climate change and the environment and the world around them, which can then lead to the negative eco emotions such as eco anxiety. Also, adolescents are more likely to experience increased climate change and environmental related stressors, such as heat waves, flooding, wildlife throughout their lifetime. Um, Eco-anxiety can then develop into chronic stress, especially for those who are living closest to those impacts. And this chronic stress can actually cause structural changes in the brain since adolescents are still developing cognitively. And that can actually increase risk for psychopathology development, such as anxiety and depression, or it could worsen existing mental health disorders. So adolescence serves as a really opportune time for intervention in addressing eco-anxiety. And by supporting adolescents who are experiencing debilitating psychological impacts of climate change, we can build stronger, more resilient generations in the face of the global environmental crisis. So the objective of this study was to estimate prevalence of eco-anxiety in British Columbia from 2022 to 2024, and then to identify regional differences in eco-anxiety across the province. So the way in which the data is collected is through the Youth Development Instrument, or YDI. It's a school-based survey for grade 10 to 12 students aimed at identifying resources, opportunities, and practices that contribute to positive youth development. The YDI is led by my supervisor, Dr. Histina Samji, but is also a larger collaboration with the BC CDC, SFU, and the Human Early Learning Partnership at UBC. And the survey was developed and first piloted in 2020 and has occurred annually in the spring since, except for this year. We've taken a break, but we do have data collection from 2021 to 2024. It's a really lengthy survey. It takes about 45 minutes to complete. There are 5 dimensions on the YDI survey: social and emotional development, social well-being, learning environment and engagement, physical and mental well-being, and the navigating the world section. And this navigating the world section, which I've highlighted on the bottom, contains questions that measure youth views not necessarily captured in other youth well-being surveys, such as multicultural ideology, gender equality, civic duty, and then the items related to eco-anxiety and climate change are also included in this section. So this is a map of all of the school districts that participated in the 2024 cycle of the YDI. We included 31 out of 60 school districts and an additional 31 independent schools across the province. And this resulted in a little over 17,000 secondary students in our sample. And here are the demographic characteristics from 2024. As part of our demographic section, we asked about racial identity. In 2024, we had 59%, or the majority of participants, identify as white. We also measured gender identity with boy or man, girl or woman, non-binary responses, as well as students are able to select in another way, so they can type in an open text box. We also ask about whether students were born in Canada, the majority of which are, as well as the highest level of parent or guardian education, and family affluence, which is measured on a low, medium, or high scale, or socioeconomic status is another way of putting it. Now, to measure eco-anxiety, we used a shortened version of the HOG eco-anxiety scale, which was published in 2021. Respondents are provided with the prompt: over the last 2 weeks, how often have you been bothered by the following problems when thinking about climate change and other global environmental conditions, such as global warming, ecological degradation, resource depletion, etc.? The full scale includes 13 items, but we conducted some youth consultations with our Youth Advisory Council, who are a group of youth from across the province who provide youth perspective for all of our research activities. And from consultation with them, 6 items were chosen to be included on the YDI, and they're listed on the slide. So feeling nervous, anxious, or on edge, unable to stop thinking about future climate change and other global environmental problems, difficulty sleeping or concentrating, difficulty enjoying social situations with family and friends, difficulty working and or studying, and anxious that your personal behaviors will do little to help fix the problem. And the response options are not at all, several of the days, and over half the days, and nearly every day. I've also done some preliminary psychometric analyses with our existing data, and Chromebacks Alpha for the reduced version of the survey 0.91 with a unidimensional structure. The high reliability, along with our consultation with youth to decide on the most relevant items, provides strong evidence for valid use of our shortened version in a youth population. Now, looking at the 2024 data, the most commonly reported experience of eco-anxiety was feeling nervous, anxious, or on edge, with 56.8% of students indicating experience with the last 2 weeks. This also means that 43.2% of the respondents did report some experience of this in the last 2 weeks. And as you can see, there's a smaller proportion indicating higher frequency, so 6.8% indicating experience nearly every day. Additionally, just under 40% of students reported having experienced anxiety that their personal behaviors will do will do little to fix the problem. And again, we see decreasing frequency with greater frequency of eco-anxiety experiences. Less frequently reported were the items difficulty sleeping or concentrating and difficulty working and or studying, with a little over 30% of students reporting having experienced this in the past 2 weeks. These are also the response percentages for the past 3 years of data collection from 2022 to 2024. Most of the proportions stay about the same with slight variations, and that might be due to the fact that we're continuously expanding the YDI survey to include more and more school districts. So that could just be a factor of our changing sample. So again, we see these similar proportions. So about 60% or about 55% are reporting no experience, but then also about 45% of students are reporting experience of this. And also to note that these are probably likely conservative estimates. The YDI, as I mentioned earlier, they're run in schools and they're run in classrooms. So the teacher will implement the YDI survey during like a math block or a history block. But the YDI implementation happens from January to um, March of every year. So that's the time when we see probably the lowest climate impacts throughout the year. If we were to have done the YDI survey maybe sometime during the summer, unfortunately, we can't do that because it's the summer months and school isn't in session. But if we were to do that during the summer when we have the wildfires, when we have smoke and air quality heavily impacted, we would probably be seeing higher percentages of eco-anxiety. And here are the yearly averages, or sorry, yearly proportions for difficulty sleeping and or concentrating and difficulty working and or studying, with again a little over 30% of students reporting this over the year. What's noteworthy is that there is a little bit of a jump. So we see smaller proportions of students reporting no experience of difficulty working, studying, difficulty sleeping, and concentrating. We see this little jump here, about a 7 to 8% increase in the number of students who are reporting this. It could be the fact that, yes, there may be more students who are having difficulty doing daily activities as a result of their eco-anxiety, or again, it could be related to the differing number of samples that we include every year. So not sure what exactly we're seeing there. I also categorized everyone's score into 3 levels based on responses from all 6 eco-anxiety items. I won't go into too much about how the scoring thresholds were created. They weren't developed by the original authors. Instead, the HOG eco-anxiety scale is based off the Generalized Anxiety Disorder 7 questionnaire. So basically, I just took the way that they scored the questionnaire and applied it to the HOG eco-anxiety questionnaire. And from there, it was determined that a threshold score of greater or equal to 9 indicated high frequency of eco-anxiety. And we predict that as greater or equal score greater or equal to 9 is indicating that you are likely having poor mental health impacts at that frequency of eco-anxiety experiences. We also see 42.7% of students indicating no experience within the past 2 weeks, whereas 44.3% were indicating low to moderate frequency, so a score of 1 to 8. Now going to the regional differences, analyze eco-anxiety results based on health authorities. So in BC, we have 5 health authorities that manage healthcare resources, and they're outlined on the map on the slide. Vancouver Coastal Health is smallest in geographic region. It's this purple one down here. But it includes the largest proportion of the population, as it encompasses some of the largest cities within BC, including Vancouver. Meanwhile, other authorities like Northern and Interior Health are larger in geographic region due to a more spread out population. And sorry, now I should say the purple is Fraser Health. Vancouver Coastal is the orange there. So I created a table for each of the 6 eco-anxiety items to look at the proportion of responses. So for example, this table is feeling nervous, anxious, or on edge. And we see that 57.8% of students from Vancouver Coastal Health have not reported experience of this, while 56%, sorry, reported no experience in Northern Health. So the differences in proportion are quite small if we're looking at nearly every day, so about 9.2% versus 5.8% when comparing VCH and Northern Health. But when we look at some statistical analyses, there are statistical differences here. So for feeling nervous, anxious, on an edge, it is statistically significant between Vancouver Coastal Health and Interior Health, between Vancouver Coastal Health and Northern Health. Same thing for some of the other eco-anxiety items here. But what's important to note, there's a lot of information on the slide. What's important to note is that Vancouver Coastal Health was basically for all eco-anxiety items, except for like 1 or 2, was consistently different from Interior Health and Northern Health, in that Vancouver Coastal Health students were reporting lower proportions of eco-anxiety frequency. And then here is the other eco-anxiety item. So again, VCH versus Interior Health and Northern Health, VCH seeing lower proportions. And then also sometimes Island Health, so Vancouver Island here, that is encompassing most of Island Health. We also see some differences with Interior Health and Northern Health. Now, if we think about where BC has been most impacted by climate change, taking wildfires as an example, we do see some of the most pronounced climate impacts happening within Interior and Northern Health regions. I conducted an analysis comparing eco-anxiety levels at the school district level as well, and I don't have enough time to go through those results, but we see similar patterns in that certain school districts, such as those in the Kootenays, located in the Interior Health, and has been heavily impacted by wildfires in the past years, do have the highest rates of eco-anxiety in comparison to other places in the province. So for final conclusions, nearly 60% of youth are experiencing some form of eco-anxiety. 13% are categorized to have high frequency, which is associated with poor mental health outcomes, and 44.3% have mild to moderate frequency, which may have varying impacts on health and well-being. Eco-anxiety was found to differ across health authorities, with Interior Health and Northern Health most likely to experience greater frequency than those in Vancouver Coastal Health. Yes, and that brings me to the end of my presentation. I'd like to thank the wonderful CHART lab research team that I work with and my supervisor, Hasina, for supporting me in my work, as well as the many partners, organizations, and funders that support the Youth Development Instrument, and specifically the BC Ministry of Health Seed Grant that is partially funding my thesis work and the work that was just presented. Thank you very much, and I'm happy to take questions. And please do feel free to email me as well, as I'm more than happy to chat about these topics with folks.
Great. Thanks very much, Judy. That was a really great presentation. It's great to see more of the YDA results coming out as well. So it's such a great instrument. And do we have any questions here for Judy? The end of a long day, Judy might get off light without any super tough questions. Let's see. Okay, so a question from James. First, a comment. Great to hear this data presented. You're doing such great work. Have you been able to correlate the eco-anxiety scale scores to other measures of depression or anxiety to explore how they relate to other measures of depression and anxiety?
Yeah, thank you very much, James. And that's a really great question. So I haven't done it specifically for the 2024 data, but I've done it for years in the past. And what we see is that depression and anxiety is correlated with eco-anxiety. So we include measures of the GAD-2, so the Generalized Anxiety Disorder 2, and the PHQ-8 for depression on the YDI, and there definitely is a correlation there. I've also looked at other things like positive mental health as well as life satisfaction. If I'm remembering correctly, positive mental health had a slight, relationship, but life satisfaction was not related with one another. So perhaps certain levels of eco-anxiety it is not impacting life satisfaction at that larger level yet. But I am doing some modeling as well with the demographic factors. And what we see is that having depression or anxiety, or screening positive for depression or anxiety on the YDI, is highly associated with experiencing greater eco-anxiety, as well as experiencing it at a higher, at that high level where it's likely to impact your mental health.
Okay, that all makes sense. Okay, well, thanks very much, Judy. I look forward to seeing more information come out of the YDI, and best of luck with all the work.
Thank you so much.
And with that, we are drawing today's session closed. I really hope that everybody enjoyed the sessions as much as I did today. It was such a great mixture of workshops, academic presentations, and learning about other people's programs. So I hope you can join us again tomorrow. We have a great panel in the morning talking mobilizing communities for resilience. And then we have another poster presentation on interventions. Um, and at 11, we'll have the presentations on public health systems and community approaches to climate well-being. And then at 12, we'll have a workshop, collaging climate emotions. And then we'll wrap up the day with presentations and discussion about art and community-based approaches to climate well-being. We did touch on that today, so I know there's a lot of interest there. So I look forward to tomorrow. Thanks, everybody, and have a great evening.